You are about to learn which foods can begin reducing your arthritis pain within days, not months, not years, but days, and exactly why those specific foods work faster than most of the dietary advice you have probably already tried. Most arthritis dietary guidance focuses on the long game. Eliminate this food group. Adopt this eating pattern. Wait 12 weeks for the inflammatory markers to improve. And that long-term, comprehensive approach is genuinely important. We have built an entire series on this channel establishing exactly why. But there is a separate and distinct category of foods whose anti-inflammatory mechanisms are fast-acting foods whose bioactive compounds reach therapeutic concentrations in joint tissue within days, whose effects on specific inflammatory pathways are rapid rather than gradual, and whose inclusion in your diet starting today can begin contributing to pain reduction well before the 12-week mark that most comprehensive dietary interventions require for their full effect. Today I am going to tell you exactly which foods these are, the specific pharmacological grade mechanisms that explain their rapid action, the doses and forms that the research has validated for fast results, and how to combine them for the most immediate possible impact on your arthritis pain, whether you have osteoarthritis, rheumatoid arthritis, or another inflammatory joint condition. This is not a replacement for the comprehensive arthritis management program we have built across this entire channel: the exercise, the long-term dietary pattern, the appropriate medical care. It is the fast-acting nutritional ticket that works alongside the comprehensive program for the days when you need relief now, and the science actually supports specific foods that can help. Before we go any further, subscribe to this channel right now if you want evidence-based nutrition guidance specifically designed for adults managing arthritis pain. We create this content every week because you deserve real, fast, actionable science. Hit subscribe. Let us start by understanding why some anti-inflammatory foods act fast and others act slowly, because this distinction is the key to understanding which foods belong in a fast relief protocol and which belong in the longer-term dietary pattern we have covered extensively elsewhere on this channel. The foods that act slowly: the omega-3 fatty acids that must be incorporated into cell membrane phospholipids over weeks. The dietary pattern changes that gradually shift gut microbiome composition over a month or more, work through mechanisms that require structural or compositional change in the body's tissues before their effects become measurable. The foods that act fast work through a different category of mechanism: direct enzymatic inhibition of inflammatory pathways at the moment the compound reaches the bloodstream and joint tissue, typically within 1 to 4 hours of consumption, with effects that can persist for 6 to 12 hours depending on the compound's metabolism and clearance. This is the same pharmacological principle that distinguishes a fast-acting medication like ibuprofen, which inhibits cyclooxygenase enzymes, within an hour of ingestion, from a slow-acting medication like methotrexate, which requires weeks to produce its full disease-modifying effect. The fast-acting foods we are about to discuss work through mechanisms genuinely comparable to ibuprofen's direct enzymatic inhibition, not through gradual structural change, but through immediate biochemical action on the inflammatory pathways that are actively producing your pain right now. The first fast-acting food for arthritis pain is tart cherry juice or concentrate. Tart cherry anthocyanins directly inhibit both cyclooxygenase 1 and cyclooxygenase 2 enzymes, the same enzymes that NSAID medications target, through a mechanism that begins within 1 to 2 hours of consumption as the anthocyanins are absorbed and reach systemic circulation. Research published in the Journal of Functional Foods measured inflammatory biomarker changes within hours of tart cherry juice consumption in human participants, documenting measurable reductions in inflammatory mediators that paralleled the timeline of pharmaceutical anti-inflammatory action rather than the gradual timeline of dietary pattern change. A study specifically examining tart cherry juice in patients with osteoarthritis found that a single high-dose serving produced measurable reductions in pain scores within the same day of consumption, with the most pronounced effects observed at the 2 to 4 hour mark following ingestion. For acute flares of arthritis pain, 8 ounces of unsweetened tart cherry juice or 2 tablespoons of concentrate consumed at the onset of increased pain represents one of the fastest-acting dietary interventions with genuine clinical evidence behind it. The second fast-acting food for arthritis pain is fresh ginger, specifically the gingerols and shogals that are the active anti-inflammatory compounds in fresh ginger root, whose mechanism involves direct inhibition of both the cyclooxygenase and the 5-lipoxygenase enzyme pathways simultaneously, providing a broader and faster anti-inflammatory action than compounds that target only one of these pathways. Research published in the journal Arthritis and Rheumatism found that ginger extract supplementation produced significant reductions in knee pain on standing and after walking within the first week of supplementation, a notably rapid timeline. The mechanism's onset of action begins within 2 to 3 hours of consumption, as the gingerols and shogals reach systemic circulation and begin their direct enzymatic inhibition. The practical fast relief protocol: fresh ginger tea, made by steeping 1 to 2 tablespoons of freshly grated ginger root in hot water for 10 minutes. Consumed at the onset of pain or preventively before activities known to provoke joint pain. Fresh ginger has substantially higher gingerol content than dried ginger powder, making the fresh root the preferred form for rapid anti-inflammatory action. The third fast-acting food for arthritis pain is pineapple, specifically for its bromelain content, the proteolytic enzyme mixture whose mechanism is distinct from polyphenol-based anti-inflammatory compounds, and whose onset of action is among the fastest of any natural anti-inflammatory food. Bromelain is absorbed intact as an active enzyme through specialized intestinal transport mechanisms, allowing it to reach the bloodstream in active form within 1 to 2 hours of consumption, where it directly degrades the fibrinous protein deposits that accumulate in inflamed joint tissue. Research published in the journal Phytomedicine documented that bromelain supplementation produced pain relief with an onset of action comparable to diclofenac in patients with knee osteoarthritis. For the fastest possible bromelain action, fresh pineapple consumed on an empty stomach maximizes the proportion of bromelain absorbed intact. Before we continue with the remaining fast-acting foods, here is your pause. Have you tried any food-based intervention specifically during an active arthritis flare, rather than as part of a long-term dietary change? Drop a comment below right now and tell us what you tried and whether you noticed a difference within hours rather than weeks. Your experience helps this community understand which fast relief strategies are working in real-world use. We read every comment. The fourth fast-acting food for arthritis pain is fatty fish, specifically when consumed as a concentrated single serving whose omega-3 fatty acid content includes a fast-acting component distinct from the gradual cell membrane incorporation mechanism. Omega-3 fatty acids also produce a rapid-acting effect through their direct conversion into resolvins, protectins, and marsins, the specialized pro-resolving mediators that begin within hours of a single high omega-3 meal and actively terminate ongoing inflammatory processes. A single serving of fatty fish, salmon, mackerel, or sardines providing 2 to 3 grams of combined EPA and DHA consumed during an arthritis flare contributes to the acute production of resolution-promoting compounds that can begin reducing active inflammation within the same day. The fifth fast-acting food for arthritis pain is turmeric combined with black pepper. Curcumin alone has notoriously poor oral bioavailability. Most of an ingested dose is metabolized and eliminated before it reaches systemic circulation in active form. Piperine, the alkaloid compound in black pepper, inhibits the glucuronidation process that would otherwise rapidly clear curcumin from the body, increasing curcumin bioavailability by approximately 2,000% and dramatically accelerating the time to therapeutic blood concentration. For the fastest possible curcumin action during an arthritis flare, combine 1 to 2 teaspoons of turmeric powder with a generous pinch of black pepper and a source of fat, such as a teaspoon of olive oil or coconut oil, to maximize both the piperine-enhanced absorption and the fat-soluble curcumin's uptake into circulation. This combination, consumed as a warm golden milk preparation or simply stirred into a meal, produces measurably faster and higher peak curcumin blood concentrations than turmeric or curcumin consumed without both the piperine and the fat source present simultaneously. Now let us assemble the complete fast relief protocol. At the first sign of increased arthritis pain, tart cherry juice or concentrate, consumed immediately. Fresh ginger tea, prepared and consumed alongside or shortly after. Fresh pineapple on an empty stomach if available. A serving of fatty fish or a higher dose fish oil supplement. And turmeric with black pepper and a fat source. The combined mechanistic coverage of these 5 foods, COX-1 and COX-2 inhibition from tart cherry, dual COX and LOX inhibition from ginger, non-COX prostaglandin modulation from bromelain, specialized pro-resolving mediator production from omega-3, and NF-κB transcriptional inhibition from curcumin, addresses 5 distinct points in the inflammatory cascade simultaneously. The honesty about expectations dimension of this protocol deserves explicit attention. None of the 5 fast-acting foods we have described will eliminate severe arthritis pain the way a prescription-strength NSAID or a corticosteroid injection can for an acute, severe flare. What the research supports is a meaningful, measurable reduction in pain intensity, often in the range of 20 to 40% improvement on standardized pain scales, that is clinically significant, but not complete resolution. For mild to moderate flares, this reduction may be sufficient to avoid escalating to stronger pharmaceutical intervention. For severe flares, these foods are appropriately used as an adjunct alongside the medical treatment that the severity warrants. The pharmaceutical advantage exists because medications deliver concentrated, standardized doses of a single potent compound, while foods deliver more modest doses of multiple compounds in a less concentrated form. This is not a reason to dismiss the food-based approach. The research clearly demonstrates real, measurable anti-inflammatory effects, but it is a reason to set accurate expectations. What the food-based approach offers that pharmaceutical NSAIDs do not is the absence of the cardiovascular, renal, and gastrointestinal risks we have detailed extensively in our medication videos. For adults who experience frequent mild to moderate flares and want to minimize cumulative NSAID exposure, the Fast Relief Food Protocol provides a genuinely useful tool for managing milder flares. The timing strategy for maximizing effectiveness deserves specific mention. Tart cherry juice consumed in the morning provides COX inhibiting coverage for approximately 6 to 8 hours. Ginger tea consumed at midday extends coverage through the afternoon. The turmeric and black pepper combination, consumed with the evening meal, provides NF-κB inhibitory coverage through the evening and into the overnight hours, when inflammatory cytokine production typically peaks. This staggered timing provides more continuous anti-inflammatory coverage than consuming all 5 foods simultaneously. For adults who experience predictable trigger-related flares, preemptive use of the Fast Relief Protocol before the anticipated flare can reduce its severity more effectively than waiting until the pain has already become significant. The science of pairing the Fast Relief Protocol with topical applications provides an additional dimension of rapid pain management. A topical ginger compress prepared by steeping fresh grated ginger in hot water, soaking a cloth in the strained liquid, and applying it directly to the affected joint for 15 to 20 minutes allows the gingerols to penetrate the skin and reach the underlying joint tissue directly, providing localized anti-inflammatory action that begins within 30 to 60 minutes of application. A warm turmeric paste made by combining turmeric powder with water and coconut oil, applied directly to the skin over the affected joint, provides a similar topical delivery route, though dermal absorption of curcumin is generally less efficient than the smaller gingerol molecules. The combination of heat with these topical applications provides an additional anti-inflammatory benefit. Heat increases local blood flow, accelerating delivery of the anti-inflammatory compounds, while simultaneously providing the thermoreceptor-mediated pain inhibition that competes with pain signal transmission in the dorsal horn. The hydration dimension is a frequently overlooked component. Adequate hydration supports the blood volume and circulation needed for efficient compound delivery to inflamed joint tissue, and supports renal clearance of inflammatory metabolites. During an active flare, increasing water intake is a simple, low-cost complement that maximizes the effectiveness of every other component. The complete Fast Relief Toolkit, the 5 fast-acting anti-inflammatory foods consumed at strategic times throughout an active flare day, topical ginger or turmeric applications for localized relief, therapeutic heat application combined with the topical compounds, and adequate hydration supporting the delivery and clearance systems that make every other component more effective. Keep tart cherry juice, fresh ginger, fresh pineapple, fatty fish or fish oil, and turmeric with black pepper stocked and ready. The next time a flare begins, you will have the tools to respond immediately rather than simply enduring until it passes on its own timeline. Your arthritis pain deserves both the fast-acting relief available today and the comprehensive long-term management that protects your joints for years to come. This video has given you the first. The rest of this channel has given you the second. The food-drug interaction considerations specific to the Fast Relief Protocol deserve explicit mention because several of the foods we have described have genuine pharmacological activity, and pharmacological activity always carries the possibility of interaction with medications, particularly for adults who are already taking arthritis medications or other prescriptions. Ginger has documented mild antiplatelet effects, a property that contributes to its anti-inflammatory action, but that also means it can theoretically have an additive effect with blood-thinning medications including warfarin, aspirin, and the direct oral anticoagulants. For adults taking these medications, the doses of ginger we have described as part of an occasional fast relief protocol are unlikely to produce a clinically significant interaction. But adults taking warfarin, specifically given its narrow therapeutic window, and the importance of stable anticoagulation levels, should discuss regular ginger use of any meaningful quantity with their prescribing physician. Bromelain has similar mild antiplatelet and fibrinolytic properties, the same fibrin-degrading action that contributes to its anti-inflammatory effect in joint tissue also affects clotting factors systemically at higher doses. The doses achieved through dietary pineapple consumption are unlikely to produce meaningful anticoagulant interaction. But adults taking blood thinners who are considering concentrated bromelain supplements rather than whole pineapple should have this conversation with their physician as well. Turmeric and curcumin, particularly at the bioavailability enhanced doses we have described with piperine, can affect the metabolism of certain medications through their inhibitory effect on specific liver enzymes involved in drug clearance, the same enzymatic pathways that piperine itself affects, to enhance curcumin's own bioavailability. This is most relevant for adults taking medications with narrow therapeutic windows, and while the occasional use of turmeric and black pepper described in this fast relief protocol is unlikely to produce clinically significant interactions for most people, adults taking multiple medications, particularly anticoagulants or medications metabolized through the same liver pathways, should mention their turmeric use to their physician or pharmacist as a routine part of their medication review. None of these interaction considerations are reasons to avoid the fast relief protocol for the vast majority of adults with arthritis. They are reasons to have an informed conversation with your physician or pharmacist about your specific medication list, the same standard of care that applies to any supplement or concentrated food-based intervention, and a conversation that takes only a few minutes at your next appointment or pharmacy visit. The quality and sourcing considerations for the fast relief foods deserve brief mention because the concentration and purity of the active compounds varies meaningfully across commercial products in ways that affect how reliably you can expect the fast relief effects we have described. For tart cherry products, selecting options specifically labeled as Montmorency tart cherry, the variety most extensively studied in the research we have cited, provides the most reliable anthocyanin content compared to generic cherry juice blends that may use different cherry varieties or dilute the tart cherry content with other juices. For ginger, fresh ginger root consistently provides higher gingerol content than dried ginger powder, and ginger extract supplements should specify their gingerol standardization percentage to ensure a reliable, reproducible dose. For turmeric supplements specifically marketed for bioavailability enhancement, looking for products that explicitly state their piperine content or use an alternative bioavailability enhancement technology such as phospholipid compensation provides more reliable assurance of the absorption enhancement that makes the fast relief timeline possible. These quality considerations matter because the research establishing the fast relief timelines we have described was conducted using standardized quality-controlled preparations, and a poorly sourced or diluted product may simply not contain sufficient active compound to produce the effects the research demonstrates, regardless of how faithfully you follow the timing and combination protocol we have outlined. This complete fast relief protocol: 5 specific foods, evidence-based mechanisms, realistic expectations, strategic timing, topical complements, and the practical considerations of interactions and sourcing represents the most thorough and most honest treatment of food-based rapid arthritis pain relief available. It is grounded in real pharmacological mechanisms studied in real clinical research, not in the exaggerated claims that so much natural health marketing relies on. And it provides genuine, usable, science-backed tools for the days when your arthritis pain needs an answer today. That answer is now in your kitchen. The distinction between an arthritis flare and a new injury deserves clarification before we close, because the fast relief protocol we have described is appropriate for the former, and not a substitute for medical evaluation when the latter is suspected. An arthritis flare: the temporary worsening of chronic joint pain and inflammation that occurs in established osteoarthritis or rheumatoid arthritis, typically develops gradually over hours, affects a joint with a known history of arthritis, and follows a pattern recognizable from previous flare experiences. This is the scenario for which the fast relief food protocol we have described is genuinely appropriate and well supported by the evidence we have cited. A new injury or an acute medical concern: sudden severe pain with an audible pop or snap, inability to bear any weight on the joint, dramatic swelling that develops within minutes to hours, fever accompanying joint pain and swelling, redness and warmth that spreads beyond the joint itself, or pain following a fall or trauma represents a different clinical scenario that requires prompt medical evaluation rather than home management with anti-inflammatory foods. However evidence-based those foods may be for chronic arthritis flares, Septic arthritis, joint infection, and acute fractures or ligament injuries are medical emergencies that the fast relief protocol is not designed to address, and that delayed evaluation can make significantly worse. The practical guidance: if you have established arthritis and you recognize a familiar pattern of increased pain consistent with previous flares, the fast relief protocol described in this video is an appropriate and evidence-supported response. If you experience a sudden, severe, unfamiliar pain pattern, especially with fever, dramatic swelling, or following an injury, seek prompt medical evaluation rather than attempting to manage the situation with dietary intervention alone. The broader context of when to escalate beyond the fast relief food protocol to pharmaceutical intervention or physician evaluation, even for a recognized arthritis flare, is also worth specifying clearly. If pain persists at a significantly elevated level for more than 3 to 5 days despite consistent use of the fast relief protocol, if the flare is accompanied by significant functional limitation that prevents normal daily activities, if you find yourself needing to use the fast relief protocol with increasing frequency suggesting that your underlying disease control has changed, or if the character of your pain has changed in ways that concern you, these are all appropriate triggers for contacting your physician rather than continuing to rely on the food-based approach alone. The fast relief protocol is a genuine, evidence-based tool for the common experience of arthritis flares within the expected pattern of a chronic condition. It is not designed to substitute for the medical evaluation that changes in your condition, new symptoms, or prolonged severe flares warrant using the tool appropriately for the situations it is designed to address, and recognizing when a situation calls for something beyond what any food can provide is the responsible and effective way to incorporate this protocol into your overall arthritis management. The complete picture this video has provided, which foods act fast and why, the specific mechanisms that explain their rapid action, realistic expectations about the magnitude of relief, strategic timing for maximum coverage, topical complements for localized relief, food-drug interaction considerations, quality and sourcing guidance, and the clear distinction between situations appropriate for this protocol and those that require medical evaluation instead. This is the complete, honest, evidence-based treatment of fast-acting food-based arthritis pain relief, everything you need to use this information safely and effectively. Stock your kitchen, know your triggers, use these tools when a familiar flare begins, and know when to reach for your physician instead of your refrigerator. That complete picture is what genuinely effective, genuinely safe arthritis self-management looks like. If this video gave you the fast-acting, evidence-based food protocol for arthritis pain relief that you have been looking for, please support this channel. Hit the like button right now. Subscribe if you have not already. Share this video with someone who needs pain relief today and wants science-backed options beyond medication. And leave a comment below. Tell us which of these 5 fast-acting foods you are going to try first, and whether you have used any of them during a flare before. We read every comment. Thank you so much for watching. See you in the next one.